I'm hoping to learn a little bit more about medical education.
Is to continue to see the transformation that I think's occurred in the last 6-7 years, at least as long as I've been involved. To be able to blend and get a balance between the clinical heart and soul of who we are as individuals, and also be able to leverage ourselves as a community and do more collaborative research.
Hoping to learn more about sustainable models for integrated care and how to manage that from a financial perspective.
My expectations for the conference have already been exceeded.
Tell me more.
The first plenary was a knockout, and I saw new ways of conveying information in a way that catches an audience and brings them in so powerfully and immediately want to use it. Want to use all the films of each of those presentations, and I can think of audiences that I would want to see most of those different ones. It was really very powerful.
And I want to find ways to disrupt the status quo, and in particular, Dr. Long's presentation last night just really struck a chord. So far, so good.
My expectations of the conference, I think, are to be able to... I work at a family medicine residency program. I'm new in my position, and what I'm hoping to gather are some things that I can bring back, as we are moving towards ABCMH right now, just in the beginning stages of our transformation. And I think it's going to be really important for me to be able to bring back just some more data, if you will, some more support for this system and support for the integration of behavioral health care.
My expectations for the conference are to find concepts and to get inspired, but also to find some concepts that I can apply systemically to the work that I do now, which is not in a clinic, but is with other agencies. And so much of the thing that we learn, we can transfer to other aspects of our jobs. So that's what I'm looking for.
So what are your expectations of the conference this weekend?
You know, I come here expecting to have a fire lit, and it happens. I come for information, I come for education, I come for knowledge, ideas, but a lot of it is to have that enthusiasm reinvigorated.
Well, I come first and foremost to continue to network with colleagues who I enjoy and respect, and to learn about new models of collaborative innovative care and integrated care, to hear about some of the updates on both professional issues, research and policy.
All right, Dr. Long,
Yes.
what are your expectations of this conference this weekend?
Running into very intelligent, motivated people who want to do good things for patients in a cooperative, collaborative manner, which is not something as a family doctor that I was intentionally exposed to during traditional medical education and residency education. So this is my first time at this conference. I'm incredibly encouraged and excited and hopeful about the future.
My expectation of this conference in Colorado is that we set off a spark that will just catalyze not just the people that are here at the conference, but the people that they serve when they go back home. I truly believe that that's where collaborative care needs to take root, and I think that's where it's going to grow.
I think to continue the process of putting CFHA on the map, furthering the movement to integrate mental health in primary care and mental health in medical care, to impress those who are watching our conference, key people who are in the audience and who are following us on Twitter and other places, and to, for my own purposes, learn new stuff.
So what did you enjoy about the plenary last night?
I enjoyed people speaking from their experience and from their heart about something that was relevant to all of us. And I enjoyed the visuals. So it was a kind of a combination of a cognitive and affective experience. And the compression of what they said, as opposed to the kind of meandering that people often do. And all done without PowerPoint slides, which I find abominable.
Exactly.
So it helped me, the lighting helped me focused on the people.
Sure.
Instead of the typical presentation of focusing on the bullet points.
Exactly.
So really terrific for me.
What are your expectations of the meeting here this year?
I've been coming forever. I'm one of the founders of the organization back in the 90s. And so my expectations are going to keep moving, pushing the envelope forward.
Great. Okay. Thanks for the time.
Okay.
All right.